Today I will be presenting Professor Chitpin and I's paper entitled Educational Decision Making During COVID-19 in Ontario. So just a brief note, Professor Chitpin is the founder of the Equitable Leadership Network at the University of Ottawa, and that's the research unit with which the presentation of the paper was done under. Okay, so before we begin, I would just like to take a moment to pay respect to the Algonquin people, who are the traditional guardians of this land. We acknowledge their longstanding relationship with this territory, which remains unceded. We pay respect to all Indigenous people in this region from all nations across Canada who call Ottawa home. And we acknowledge the traditional knowledge keepers, both young and old, and we honor the courageous leaders past, present, and future. So to start the presentation, I just wanted to go over the context of the study within which it was conducted. So the study was conducted in the Greater Ottawa area in Ontario, Canada during the months of December 2020 to late January 2021. So on December 21st, the provincial government had announced a province-wide lockdown due to high spread of the virus and an increase in hospitalization across the province, which would take into effect the eve of December 26th. So part of the government's lockdown plan included the immediate closure of public and private schools and the temporary re-implementation of remote learning for at least 28 days. Now, on January 2nd, the Ministry of Education issues a letter to Ontarian parents stating that elementary schools would return to in-person learning as of January 11th, and that secondary schools would be returning on January 25th, despite the continuous rising cases of COVID-19. So then on January 12th, the provincial government declared a state of emergency and extended online learning until February 10th. However, later that month, on January 28th, the province, in consultation with Ottawa Public Health, took the decision to reopen all schools on February 1st, giving educational leaders very little time to reformulate their school reopening plans. So this context was anecdotally reported as creating stress and anxiety for all educational staff, as evidenced by news articles and personal posts on social media. So the current study really aimed to explore the challenges faced by educational leaders as they work towards mobilizing their schools during this period in this context of the pandemic. So just to briefly touch over some background literature. So as we all know, the pandemic created a chaotic situation within the educational realm, resulting in detrimental impacts on students, their families, and schools as a whole. So in Canada, the country saw a decrease in instruction hours per week, significant concerns regarding the ability to provide students with the resources needed for them to be successful in engaging with remote learning, as well as fears that prolonged remote learning would only exacerbate achievement gaps within Canadian schools. So the move to online learning created a digital divide in education through factors such as internet stability, and this digital divide was experienced both by instructors and students and led to inequalities within the school system, where some studies have shown that racial and ethnic minority groups living in poverty were particularly vulnerable to barriers preventing their access to high quality and inclusive remote learning. So when we look at estimations of the disruption caused by school closures, it shows that children from such disadvantaged backgrounds will likely see a 7 to 11 month loss in their learning. So in this way, the pandemic not only brought forth a danger to the physical health of individuals, but it also introduced a plethora of factors impacting the overall well-being of communities. So in response to this, the Organization for Economic Cooperation and Development Canada put forth a call for educational leaders to develop and implement various strategies in an effort to mitigate the impacts of the pandemic on students. So in this way, educational leaders have been faced with the task of rapidly finding ways to address these challenges within their schools, while also respecting the COVID-19 processes and protocols mandated by their provincial governments. So the pandemic has really plunged leaders in a crisis, requiring them to make critical decisions with constraints such as ambiguity, lack of time, and lack of information, resulting in the experience of very high psychological pressure. So again, leaders are faced with all these novel concerns arising as a result of the virus, such as increased sickness rates, staff quarantine, social distancing requirements, and more, which resulted in educational leaders having lower social support in conducting their roles. This is only further complicated by the fact that education policies developed by governmental bodies are at times contradictory to those being implemented elsewhere in the country, leaving leaders in a complex and confusing situation. And when we are looking at the well-being of teachers, a factor which educational leaders have to address, a study conducted in Canada showed that over 1,000 teachers reported increased stress related to the profession, directly related to the novel circumstances of the pandemic, as teachers had to cope with increased anxiety and stress related to the pandemic, such as catching the virus and transmitting it to their families. Of course, this is only worsened by the reopening of schools. Beyond these immediate threats to education staff health, the awareness of the inequities and subsequent achievement gaps caused by remote learning present yet another point of distress for teachers. So unsurprisingly, these working conditions put onto teachers the experience of chronic stress, which has been known to lead to professional burnout. And this has to be taken into consideration by educational administrative staff, because it is well documented that teacher chronic stress is correlated to negative outcomes for students, including lower academic achievement. So to better adapt their decision-making and to effectively manage the COVID-19 crisis, the leadership style chosen by educational administrators becomes increasingly vital in managing and mitigating the detrimental impacts of the pandemic on their school community. So one model which is often recommended is distributed leadership, which is a collective decision-making model which acknowledges and involves all of the actors in decision in the school. So for example, it could include principals, vice principals, teachers, students, and support staff. Perfect. Okay, so for this paper, it draws upon empirical evidence from a social sciences, so a CERC Insight grant. The study was guided by the following 4 questions. So what challenges do educational leaders face regarding COVID-19? What are the primary social, political, and research-based influences regarding their decision-making process? What resources do educational leaders need to support decision-making? And how does networking with other educational leaders influence decision-making? So this was a qualitative case study, and it explored the experience of 11 educational leaders in the Greater Ottawa region working within Francophone schools. So the participants were diverse in terms of their gender and years of experience in educational administration, and it involved both educational leaders within elementary and secondary schools. So there were 3 main themes that were found in the interview transcripts. So the themes were a lack of resources to aid in decision-making, challenges in managing staff, and the use of distributed leadership and networking to aid in decision-making. So when we're looking at lack of resources, we know that the pandemic has pushed leaders to find a balance between quickly enacting decisions while also taking the time to carefully consider the potential consequences of these decisions. So given the inconsistencies in the political and public health discourse as evidenced by the Ontario government's communication, which I mentioned in the context, this has left educational leaders in a position where they were and continue to be responsible for student, staff, and educational delivery, while also having little control and only a vague understanding of the evolving pandemic situation and protocols. So within our study, participants unanimously expressed frustration with the Ontario government's unclear guidelines and the lack of resources provided by the province. In fact, the participants communicated a need for more robust guidelines and training opportunities from both public health and the school boards for which they work to aid them in making equitable decisions for the safety of their students. And as for example, one of the participants had said, as a principal, what I find difficult presently is that the Office of Public Health often repeats that the COVID-19 guidelines are recommendations. But when you hear the word recommendation, you hear that it is optional. So taking, for example, the Ottawa Public Health form, which parents had to sign when their kids returned to school after being sick with COVID, the participant says they did not tell us it was optional, but the last time we did an update, we were told we are reminding you that this form is optional. At what time it was required, then it was optional. So we find ourselves in situations where we are making a choice to use it or not. So such last-minute changes are vague guidance by government bodies requiring leaders to adapt has been mentioned throughout the world, where many have had to learn to work within the boundaries of unclear guidance. Now, when we look at the challenges in management, the pandemic has brought on a dissolution of routines within school systems, which has heightened the experience of stress and anxiety for both staff and students, like I mentioned previously. So this disrupted fluidity of routine presented a significant challenge for the participants in the study as they were faced with new and novel concerns. For example, one participant mentioned, we all want to assemble before class and chat, but I need to maintain the directives and make people act in the opposite way that they want to. it is difficult to manage teachers and make them change the way they have been doing things for years now. So in order to mitigate the potentially life-threatening impacts of the COVID-19 pandemic, many have emphasized the need for clear and frequent communication within the school community. And this was also reflected by our participants, who stressed the need to communicate with all members of the school community. For instance, one participant had mentioned, "I have never sent so many emails before. I am worried and always a little worried. I need to ensure that the emails are being opened." So in addition to the need to manage the physical aspects of the pandemic, the participants highlighted the challenges in managing the psychosocial, psychological factors encountered by staff when trying to implement COVID-19 protocols. And these findings also provide additional support to the literature demonstrating that Canadian teachers are experiencing increased job demands and more likely to experience stress and burnout, impacting the overall quality of education within the school. And that's where distributed leadership and network came in to help with regards to the decision making of educational leaders. So again, the pandemic has highlighted the need for distributed leadership to support the overall well-being of teachers. For example, one of the participants had stated, "For me, my approach and my leadership is really a leadership centered on collaboration and sharing. I need to have allies before putting in place something, or I need others' advice on putting things into action and get their input on whether it will work." So now she was talking more about involving teachers in the decision making to get a collective decision and a collective action plan in place. So previous findings have also demonstrated that principals take on like a directive leadership approach for certain decisions, which do not allow for flexibility, such as those related to the COVID-19 protocols, which was shown also in our participants. However, in general, the educational leaders during the pandemic have tended to default to a form of distributed leadership in order to collaborate with and learn from others within their networks. So in this way, the leaders are relying on the collective wisdom originating from both within and outside of their schools to be proactive in their decision making as it relates to COVID-19 within their schools. So I'll just briefly mention the conclusion here. So the findings of this study did provide empirical evidence highlighting the various struggles and challenges faced by educational leaders and demonstrating the protective nature of distributed leadership practices and network when faced with a potentially life-threatening crisis. The study also provides insights into the resources needed to support educational leaders within our community, such as through the provision of additional human as well as training resources to aid them in addressing these concerns.